Okay. Ooh, I'm so excited, Ian. Okay, so I'd love to welcome Dr. Ann Katz to our speaker series. Lacuna Loft has been doing this for a little bit now. If you haven't checked out lacunaloft.org, if you're just finding us on our YouTube channel, go ahead and do that. We have a lot of programs running specifically to young adult cancer patients, survivors, and caregivers. And Dr. Ann Katz is a well-known kind of staple of a name in the YA cancer community. She has done a lot of work in the realm of sexuality and sexual health and lots of other things. I'll kind of let her get into some of that. Specifically for this talk, we're going to be talking specifically about sex and relationships, and Dr. Katz will share the advice she has given to many young adult cancer survivors during and after treatment. While YAs usually find their way with dating and new or altered relationships, they often find some need for support and guidance, or merely an open ear and heart to help them through a challenging time. So Dr. Katz will be talking about disclosing your cancer history to a new potential partner, how to deal with scars and missy body parts, and anything else that you need to be answered. I'll also note that Dr. Ann Katz is our resident awkward auntie. So she also answers these sorts of questions in an anonymous way on our website. So you can actually go to the awkward auntie part of our website and submit questions anonymously, and Dr. Katz will answer them. So I'm really excited. We met in Denver last year, kind of formally, and it's been a great kind of professional relationship for me. I just feel so honored that you're here with us today. So welcome.
Thank you so much. And I am honored to be allowed to be on this webinar. It's exciting for me, an old lady, to be able to talk about young people and sex. Because, you know, sex doesn't end when you're 27 or 30 or even 40. So I actually just read an article today. It's a national survey of sexuality and aging, and people in their 70s and beyond seem to have a lot of free time. So where should we start, Mallory? I think, you know, looking at some of the questions that have been submitted, the first question that was posed, I think, is a really great place to start, because that's about dating. And, you know, when do you tell somebody who you're dating or potentially dating or would like to date or dying to date, when do you tell them about your cancer? And this is a question that I am frequently asked. And if I had the perfect answer, well, I'd have the perfect answer. You don't get money for perfect answers. But it really is a $64 million question. So I would then have the $64 million answer, and I'd give some to Lacuna Loft.
Oh, thank you.
So, you know, I think the answer is it depends. And what young adults have told me is really dependent on the individual. So there are some people who just put it out there. We also had a question about, you know, what would you put on your dating profile? So some people, this is something that somebody would put on their dating profile, on Match or whatever those online dating platforms are. They put it out there because that then would, I guess, you know, perhaps keep away people who would be scared of a cancer history, who would see this as a, you know, game over, line in the sand kind of thing. And I think to a certain extent that putting that on your profile really offers some kind of safety, because only people who are not going to be bothered by that would then contact you. If someone is really freaked out about it, they're not going to contact you. So that might be a good idea, but it doesn't work for everybody. So some people have told me that they spill the beans. They put it out there literally within the first 5 to 10 minutes of meeting somebody for coffee. And then they look really closely to see what the response is. Now, I think that's kind of a little bit unfair, because the person who you're meeting for coffee may have their own history with cancer. They may have lost someone close to them from cancer or some other kind of life-threatening illness. And so their response might be one of shock, of sadness, perhaps a little bit of fear or anxiety. And it's not really fair because, frankly, most people in their 20s and 30s will not have had that really direct experience with cancer. So their response may not be what the young adult is looking for. So I think that's a little bit unfair. There's certainly some research that's been done in young women with breast cancer who do that. They put that, they say, by the way, I've had breast cancer. And then they not only listen for the response, but they actually look for body language. And some of the women in the study said, if the response is not what I want, or the response doesn't meet my standards, or their body image is a little bit weird, they move back in the chair, for example, that's it, I'm done. I personally think that's a little bit unfair. However, there certainly are people who have gone on a first date and, it's just coffee, right? And have said, I've got cancer, or I've had cancer, or I have a breast missing, or, I have lost a testicle to cancer. And very quickly, the other person excuses themselves to go to the bathroom and then literally dashes, which I think is incredibly cruel. And really does nothing for self-confidence, and I think just really reinforces this idea that somehow because of a history of cancer, you're damaged goods, because that's not the case at all. We know that young people who have been through cancer have experienced personal growth, are mature for their years, have really been, honed by fire, so to speak, and have a huge amount to offer somebody else. So some people have told me that they actually tell on the second date, because on the second date, there is perhaps some interest from you and the other person, but you're not in love yet, as Prince Charles once said, whatever that means. There isn't that commitment. There isn't perhaps that interest. There probably hasn't been any sharing of body fluids yet, or nobody's gotten naked yet. So, people have said to me that by the third date, there's already that interest. There's perhaps already sort of some establishment of interest that perhaps this is going to go further. And by not telling by the third date, it may appear that you're hiding something. So, best guess, I think it depends on the individual. It depends on previous experience. It depends on how much you want to expose of yourself. And I don't mean in terms of wearing clothes or not wearing clothes, but how much you want to let somebody into your private space, because that really is private space. So for some people, maybe second, for some people first.
I think that's kind of the hard part about all of the big questions that are attached to something traumatic like young adult cancer. Like, when do I tell my friends, and how do I tell my spouse, or how do I tell someone who I'm dating? And it's always, there's never like a direct answer, right? But that would be so wonderful if there was. It's always so dependent on the person's own comfort and preferences.
Yeah, and I think, in some way, you have to practice saying this a lot of times before you get really comfortable, because everybody gets hurt at some point. And I think the important thing to remember is, if there is rejection, to really try not take it personally, or, not focus on the cancer being the issue. Sometimes things just don't work. And, do you really want to be with someone who at some point is going to judge you based on something that's really not in your control? It happened to you, right? Through no fault of your own. So, you've got to dip your toe in that water. Take a chance, guard your heart a little bit, I think. And I think that goes for people who don't have a cancer history too, right? Dating's difficult. I wouldn't go back to my 20s for all the money in the world. It's difficult.
Yeah, thanks, Anne. I think that kind of easily segues into our next question, which was, how do you tell someone new that you are medically induced into menopause and have a low libido? So now we're dating and we're talking about probably having a little bit more of a serious connection with someone, but really bridging something that even without cancer is kind of uncomfortable for a lot of us.
Yeah, so the question really, refers to a woman who has now got a probably chemically or surgically induced menopause. So that is menopause years before you're supposed to go through it. And menopause refers by definition to when you haven't had a period for a year. It often comes with a lot of symptoms, hot flashes, vaginal or vulvar dryness, and we have a question about that coming up. So I think these are going in a really good order. It basically, once you're through menopause, you can't get pregnant again. So menopause can be induced through chemotherapy, through radiation to the ovaries, or through surgery where the ovaries are surgically removed. So, for example, ovarian cancer, chemotherapy, really for any kind of cancer, can induce menopause. And the older the young woman is, the more likely she is to experience menopause, or she may go through menopause much earlier than if she had not had this chemically induced situation. So, I think there like the other question, once again, it's depends. There certainly are changes that come along with the menopause, and low libido may be one of them. Men can have low libido as well, but lack of interest in sex is really, really complex. So it might be associated with going through menopause or the ovaries shutting down, but libido or desire tends to be multifactorial. So it's about how we feel about ourselves. It's about how confident we are. So it's linked to body image for many women. It can be linked to depression, certainly. And we know that about 30% of people with cancer will experience depression, often around the time of diagnosis and going through treatment. So while we have looked for reasons why libido may be low attached to hormonal changes, for women, we actually have never found any association. But certainly, if sex hurts because your vulva or vagina is dry and sexual touch or penetration is possible, of course that's going to decrease your desire, right? Why would you volunteer for pain, particularly in that sensitive area? So, I think once again, you've got to be brief, you've got to be honest, you've got to lay it on the table. And my advice is always, to just, not give everybody line, chapter, verse, write the whole book in one go, because at some point that person's just going to go, whoa, this is just too much. You perhaps want to say something like, since cancer, I'm really struggling with sexuality, and see what happens. If a partner then, or a potential partner, says, well, what do you mean? That perhaps is a time to say, well, I've had some changes in my body and my desire has changed. I don't think about sex as often. We also know, and I think this is the area that's really hopeful, we also know that for women, desire is something that is often responsive rather than spontaneous. So what do I mean by that? We've probably all been through that time when, you're in a new relationship and there's that infatuation and you're hot and ready to go at a moment's notice. You think about that person all the time and you have these like really cool fantasies about what you're going to do, and sex is super exciting and you get aroused like in a nanosecond. You hear a key in the door, or you see the door opening and that person walks in and boom, you're ready to go. That does tend to change, even in relationships in your 20s, right? Because you can't maintain that level of intensity. You got other stuff to do. You got to go to work. You got to go to school. You got to clean the apartment. So that is spontaneous desire. And often in the beginning of the relationship, it's really, really high. As time goes by and things change, and particularly for women, often that spontaneous desire is somewhat subdued. But what we have is reactive desire. That once you get things going, that is when desire kicks in. It kicks in response, in part to arousal, and women are often unable to sense when they're aroused. It's a very interesting phenomenon. They may have the signs of arousal, lubrication, for example, but they don't feel that tingle. They don't feel what's going on down there. It's an interesting phenomenon. We're not sure why it happens, probably just because of really lack of focus, messaging, right, around what good girls do and good girls don't do. So, just in a nutshell, I would give out a little information then see what questions come next, and then so give out information in little bites and kind of stop when there are no more questions.
Yeah, I think that's great advice. I appreciate that in every talk that you give, you use the word vulva, and it's been mentioned here today. I feel like that makes this an official Ann Katz talk.
I have to tell you, earlier this week, I was in New Hampshire at the Dartmouth-Hitchcock Cancer Center talking about obesity and cancer, which is another interest of mine, and I published a book on that last year. And I managed to get vulva into that, even though it had nothing to do with it. I got it in. I was proud of myself. Mallory, I can't hear you. Your mic is off.
Sorry about that. I think that leads us into our next question. How do you create intimacy when you're struggling with body image and nervous about someone seeing the scars for the first time? Because I think based on what you just explained, this probably feeds into desire and libido as well.
Yeah, so intimacy is connection. And I'm really glad that somebody submitted a question using that word, because often people use intimacy, and maybe it's an older person thing, but people often use intimacy as a euphemism for sexual activity or sexuality. So I think that the person who submitted this question really was talking about that connection. So how do you create that connection? You know, people have scars, people have body image issues, and quite frankly, I think that most everybody has got something about their body that they're wigged out about. You know, I think we used to think that women have more body image issues than men. I think sometimes that's true, but certainly with, you know, the number of videos we see about physical activity and hardcore exercising, and you see these guys who've got like a 24-pack, never mind a 6-pack. I think I think young men are experiencing some of those challenges to what is a perfect body. And it's hard sometimes to keep in the forefront of our mind that when you see pictures in magazines, etc., they're photoshopped. The bumps and the warts and the scars, right, have been photoshopped out. And even those people are in competition with other people and think that their body doesn't measure up. So, one of the things I think it's important to say is, be truthful. I have a missing breast, or I have a scar, like a damn railroad track, right, all the way down my abdomen. And I'm shy about that. I'm also somebody who believes that, while being naked is kind of cool, you don't have to be naked. And certainly if being naked and just focusing on what does he or she think about my scar, or, I bet you he or she is like judging me, really doesn't help for you to be comfortable. And if you're not comfortable, you're not going to be able to be aroused. You're going to be totally distracted. Your head's not going to be there. And the brain is the biggest sex organ we have, right? And in order to have something feel good and be satisfying, your head's got to be there. You've got to recognize the feelings, right? You've got to be present. And if you're thinking about, do I look fat, or, are they judging my stretch marks? And I think that's something that we as oncology care providers often don't talk about. Scars are one thing. They fade with time. Sometimes they'll go into a body fold. I often wish that surgeons would be a little bit more careful about where they put the scars, because there is a way of hiding them. But let's talk a little bit about stretch marks, and we know that people going through cancer often gain weight, predominantly because they put on doses of steroids and you just go whomp, right? And the skin, which is elastic, can stretch only so far, and then you land up with stretch marks. And while you may lose the weight, if you're lucky, after you're off those steroids, those stretch marks stay and can be really distressing for men and women alike. So, I think just fessing up and putting it out there, I've got these stretch marks on my tummy or on my thighs that I'm really not happy about, and I'm uncomfortable about being naked. Can I keep my t-shirt on, right? Is it okay, right? Don't judge me. So I know it takes a lot of confidence to really be that open about it. And, you know, I'm way older than the target audience for this webinar. And I've learned, you know, over time that first of all, almost all of the time, our partner is just so darn excited that maybe they're going to get some, that they really do have blinders. They've got their issues. They're more focused on, you know, can he or she think that, I don't know, my thighs jiggle? You know, we all have whatever issue it is. So to try and get that negative speak out of your head and just be in the moment, right? Focus on what feels good. And most of all, tell your partner what feels good.
Okay, so I'm hearing themes over and over of the main answer to all of these questions just being, is rooted in communication and honesty, both with ourselves and with our partner.
Yeah.
I feel like it's a good human lesson in general.
Yeah. And I think communication goes beyond that as well. I think that oncology care providers have an absolute responsibility to communicate to our patients about the sexual side effects of treatment. And we fail miserably over and over and over again. We need to talk, you know, we talk about nausea, we talk about constipation, we talk about peripheral neuropathy and numbness and tingling, we talk about hair loss. We often leave out the pubic hair loss piece, which can come as a real shock to people. And I know some women don't mind, and I guess some men don't mind either, but you've got to warn someone, right? First and foremost. And, you know, just this morning, I had a phone call from a woman who wanted to come in to talk about that kind of stuff. She's in the middle of chemo and no one's told her. Yeah, I'm shocked and horrified, and I'm going to march over to that chemo unit and give them a bit of a lecture, or rather a gentle reminder to talk about these kinds of things. So we have a responsibility to talk to our patients about this, but I also want to encourage people to ask their oncology care providers, because we know from research that, yeah, we'll answer your questions, but we want the patient to raise the topic because we don't want to offend and we don't want to seem weird. And it's particularly important, I think, at sort of the two ends of the age spectrum. We're really cautious, particularly around adolescents, because often they have a parent with them. And we don't want anyone to get all hot and bothered that we're somehow encouraging sexual activity, which I think is really an ostrich with a head in the sand, right? So we're often a little skittish about talking to sort of people in the younger age range about this, or we make assumptions about people. We assume that they're straight when they're not, when they're gay or lesbian or questioning or bisexual or asexual for that matter. And I think, you know, we have the same sort of age-related issues when we're talking about people in their 60s, 70s, and 80s. We just assume that they're not sexually active, and we're wrong. So communication works really in I don't know, I don't want to count. You've got to talk to your partner. Hopefully your partner will talk back to you. Your healthcare provider needs to talk to you, and you need to talk to your healthcare provider. So I guess that's 4 ways or 8 ways.
Yeah. I heard you say in a talk once that when healthcare providers don't bring up these things, they then seem taboo to the patient. But I think that's a really good reminder that the patients can, you know, we're trying to teach patients to advocate for themselves. And this is just another arena where they can and are allowed to do that.
Yeah, and it's, you know, I think it's really difficult. I know that I have at times when there's a mom in the room and, you know, somebody's 15, 16, because that tends to be when people become sexually active these days. Not everybody, but, you know, we certainly have the statistics on that. I will sometimes, you know, say to the person, come, I need to weigh you. Mom, well, I wouldn't say mom, quite frankly, you know, Mr. So-and-so. Do you mind just waiting in the room while I'm going to go and weigh Jane or Samantha? And that's a really good opportunity where you've got some privacy. I think, you know, it's also okay. I have actually booted parents out of the room and said, you know what? I'm going to have the sex talk now with your kid. I don't want you to be embarrassed. You know, we kind of try and embarrass the mom and or dad. You know, let me have the talk, and then, you know, no one's going to get all flustered. And sometimes that helps. The other thing is that, you know, and I tell particularly nurses this, raise the topic. The patient may be so shocked that someone has asked them that they actually don't know what to say in the moment, but they'll come back the next time and ask the question. And we really are willing to answer the question. And sometimes I think it can actually be quite funny. It's like, how do you make an oncologist blush? You ask them a question about sex. I'm kidding. Some oncologist is going to watch this and get really mad at me. But we can control our blushes. I blush sometimes, and I've pretty much heard what I think is it all. But sometimes a patient will say something to me in a way, and it just triggers something in my brain, and I blush. And I survive.
Mm-hmm. Yeah. I think with that, we have one more question, which is a little bit specific to our cancer survivors who are experiencing this particular problem, but I think it's still a great question to have you answer. Does vaginal sensitivity and dryness following cancer treatment ever resolve on its own without hormones? I know, especially because there's so much science combined with pseudoscience in what we hear in the news, and hormones in particular I feel like it's all hot topic right now. So I think this is probably a good question.
Sure. So once again, I'm going to say it depends, right? You can actually now call me Dr. Depends. Oh, that doesn't sound good. Although maybe it fits sometimes. So for some women, during and immediately after chemotherapy, for example, when your ovaries have shut down temporarily, there might be that problem with dryness and sensitivity. And then that might resolve on its own if your ovaries wake up, which for some people they do, and lubrication will come back. Lubrication is an end product of arousal and estrogen, right? So estrogen is the hormone of lubrication. So when estrogen levels start to rise again, lubrication will go up, sensitivity will go down. A lot of the pain that women experience with sexual touch or penetration is actually related to the muscles of the pelvic floor. So when sexual touch has caused irritation, in response the body tenses up, right? Because it's a response against pain. It's a protective response, and a lot of the pain really does come from the pelvic floor. And you can actually land up with a very, very tight pelvic floor with actual trigger points. And a pelvic floor physiotherapist can be really helpful in helping you get over that and help to relax the muscles of the pelvic floor. So for some women, if the ovaries wake up, estrogen production starts again, lubrication may increase, and then you get, so you won't have that sensitivity. Everybody needs to be using lube, lots and lots and lots of lube. And there are so many lubes out there now. Just don't use KY jelly. It's absolutely the worst, one of the worst lubes. People often ask me about coconut oil and olive oil and almond oil and shea butter and all those kinds of things. They're okay on the outside. They should not go anywhere near the vagina. So that's one pointer, and that's sort of for daily comfort. Not good lubricants at all. They don't work as lubricants. You shouldn't be putting any kind of oil product in the vagina itself. For women where the sensitivity really doesn't get better and they are in that perimenopausal or menopausal state, even in their 20s or 30s, if you don't have a hormonally dependent cancer, you can and should be put on hormone therapy because it's good for your bones and it's good for your heart, etc. So other than women who have a hormonally dependent cancer, where we're not so happy about hormones, even though there's debate about that. Certainly, there are some women who use some local estrogen because in reality, that is the only thing that is going to help if you are estrogen depleted and experiencing vulval or vaginal problems. So many of the gynecological cancers are not hormone dependent. Anal, rectal, or colorectal cancers are not hormone dependent. The hematological cancers are not hormone dependent, so leukemia, lymphoma, thyroid cancer, etc. So there's no reason why those women shouldn't be using hormone therapy if they need it. Long, boring answer.
No, I love it. This is so great. I think that kind of ends the questions that we've had. I'll remind everyone that you still have the opportunity to submit questions to Dr. Ann Katz, our Aqua Auntie, by going to the website. Ann, thank you so much for kind of spending time with us. Do you have any kind of closing statement or anything else you want to add?
I just think that sex is an important part of life. It makes us feel good. It's a comfort. It helps us sleep at night. And our sexuality is something that is very, very personal, but is also an important part of who we are as human beings. So, don't deny your sexuality. Just you be you, or as somebody once told me to, you do you. Yes, and please, I'm always interested in answering questions. And thank you, Valerie, for this opportunity. I was really happy and honored to do it.
Thank you so much.